So, hello, my name is Sabrina McNeil, and my presentation is on fetal alcohol effects or fetal alcohol syndrome, also known as fetal alcohol spectrum disorders. Fetal alcohol syndrome is where a mother consumes a large amount of alcohol during pregnancy, usually 8 or more drinks a week, and for fetal alcohol effects, this is where a mother consumes a moderate amount of alcohol during pregnancy, with this being 1 or less drinks a day. So for the purpose of this presentation, I'm going to be focusing on fetal alcohol syndrome. And the definition of this is a disorder that affects babies that are exposed to alcohol before birth. And here are some key statistics from the National Institute of Alcohol Abuse and Alcoholism. About 20 to 30% of women have reported drinking at some point during pregnancy. This is mostly during the first trimester. More than 8% of women have reported binge drinking at some point during pregnancy, mostly during the first trimester. Almost 10% of pregnant women reported drinking alcohol in the previous month, and almost 5% of pregnant women reported binge drinking in the previous month. And this is considered 4 or more drinks per occasion. So the prevalence of fetal alcohol syndrome, or FAS, is, according to the National Health Institute, 1 to 5% of first grade students in the U.S. have FAS. Studies using an in-person assessment of school-aged children in several U.S. communities reported even higher estimates of fetal alcohol syndrome, 6 to 9 out of 1,000 children, and this is according to the Center for Disease Control and Prevention. So as we're talking about fetal alcohol syndrome, there are some other syndromes that are related to fetal alcohol syndrome. One being partial fetal alcohol syndrome. And this involves prenatal alcohol exposure and includes some but not all of the characteristics of full fetal alcohol syndrome. Then we have alcohol-related neurodevelopmental disorder. And this requires both of the prenatal alcohol exposure characteristics and central nervous system abnormalities, which may be structural or functional. Functional abnormalities might involve a complex pattern of cognitive or behavioral problems that are not consistent with developmental level and that cannot be explained by factors other than prenatal alcohol exposure. Then you have your alcohol-related birth defects. This disorder includes medical conditions linked to prenatal alcohol exposure, such as heart, kidney, and bone problems, and other malformations, difficulty seeing and hearing, and reduced immune function. Alcohol-related birth defects is rarely seen alone, but rather as a secondary disorder accompanying other fetal alcohol syndrome conditions. So, some of the symptoms or the physical defects for a child with fetal alcohol syndrome are presented on this slide. Children with fetal alcohol syndrome may have small eyes, especially thin upper lips, short upturned noses. They may also have smooth skin surface between the nose and the upper lip. They may have deformed limbs, including joints and fingers, small head circumferences and brain size. They may have vision and hearing problems. And these children might also have heart or kidney problems and problems with their bones. In regards to your symptoms, when you're looking at the brain and central nervous system problems, these children may have poor coordination and balance, poor memory and judgment skills. These children might have intellectual disabilities, learning disabilities, or developmental delays. They may have trouble processing information and sustaining their attention, difficulty with problem solving, reasoning, identifying consequences of choices. They may be hyperactive and have rapidly changing moods. When you're looking at the social and behavior issues of children with fetal alcohol syndrome, they may have trouble in school. They may have a difficult time maintaining good relationships with others. They may have poor social skills, trouble with task switching and adapting to change, and poor impulse control or concept of time. Some other effects of fetal alcohol syndrome include anxiety disorders. Some kids may have seizure disorders. They may have psychosis, where they're hearing voices or seeing things, and also behavioral disturbances. One treatment option for children with fetal alcohol syndrome is the use of medications. The first medication that's usually tried are your stimulants, similar to those that are used to treat ADHD characteristics in children. But these other drugs that are listed here are also commonly used, and some of these medications target anxiety in children. Um, some children also take melatonin for any kind of sleep disturbances they may have. But again, medications are one method of treatment for children with fetal alcohol syndrome. When we're looking at interventions and strategies that we can use in the school setting for children with fetal alcohol syndrome, these children do well in structured environments. They do better when they have brief lessons that are presented to them, a variety of activities. They have consistent routines, and there is a repetition of material. Teachers should be mindful that they should be creative and flexible when presenting information to these children. They should demonstrate compassion and patience and always collaborate with parents to ensure the success of the students. So here's a case profile of a child with fetal alcohol syndrome. Um, this child is called Terry. He's 6 years old. He's in the first grade. He was diagnosed with fetal alcohol syndrome and ADHD. He's currently unmedicated, and the reason for the referral were behavior issues and poor grades. So the family background for Terry is that he lives with his mother and his grandmother. Mother reports that the father is unknown. Terry's mother did report that she drank heavily and binge drank during her pregnancy, and the grandmother also has a history of alcohol abuse. So the referral concerns for Terry includes that he does not interact well with peers. He often argues with them. He has impulsive behavior that makes it difficult for him to maintain positive relationships. His current grades are below average with a 50% in math and reading. The main concerns presented by the teacher includes Terry's impulsive behavior. His impulsive behavior is making it difficult for him to attend in class, which she feels is affecting his grades. And the teacher states that although Terry has lower academic skills than his peers, he is still performing far below his potential. So the data collection included a review of Terry's records. There were behavior concerns present in kindergarten. Terry had good attendance last year, and he did receive yearly follow-ups with his doctors due to poor kidney functions. The teacher stated that although Terry had good attendance last year, it is poor this year due to his mother's work schedule. She often keeps him at home due to oversleeping in the mornings. Terry has not had any major concerns with his kidneys, but continues to follow up with the doctors due to complications at birth. So Terry was administered a full psychoeducational assessment, which included a cognitive, achievement, behavioral, social, emotional, and adaptive measure. So on his cognitive measure, his scores were very low with a 75. His achievement score was low with a 70. His adaptive behavior skills score was in the below average range, and the test of behavior and social emotional skills showed him to be at risk in both social skills and attention by both the teacher and the parent ratings. So in looking at a treatment plan for Terry, one goal will be that Terry will improve social skills by demonstrating positive interactions with others. He'll do this by receiving social skills training weekly provided by the special education teacher or the guidance counselor, and also be provided with the accommodation of having a peer buddy in the school environment. So goal number 2, Terry will demonstrate on-task behaviors during whole and small group instruction. This includes looking at the teacher during instruction and keeping his hands and feet quiet. Anecdotal records will be kept by the teacher by the use of time interval data sheets. Some of the accommodations are preferential seating and a self-monitoring checklist that's going to be kept by Terry, and an FBA will be completed to determine if ABA therapy might be beneficial. Here are two helpful resources that I found. The first one is the National Voice of Fetal Alcohol Spectrum Disorders, and then also the Center for Disease and Control and Prevention. There was lots of good information on both of these sites. So now let's check your knowledge, and these are true false. Number one, fetal alcohol syndrome is a disorder that affects babies that are exposed to alcohol before birth. Number two, children with fetal alcohol syndrome may have vision and hearing problems. Number three, children with fetal alcohol syndrome never have social or behavioral problems. Number four, according to the National Health Institute, 5 to 10% of first grade students in the U.S. have fetal alcohol syndrome. And number five, children with fetal alcohol syndrome never need strategies to be successful in the classroom. So now here are the answers to the questions. So number one said, fetal alcohol syndrome is a disorder that affects babies that are exposed to alcohol before birth. This is true. Number two, children with fetal alcohol syndrome may have vision and hearing problems. That's also true. Number three, children with fetal alcohol syndrome never have social or behavioral problems. And of course, that's false because children with fetal alcohol syndrome often have social and behavioral problems. Number four, according to the National Health Institute, 5 to 10% of first grade students in the U.S. have fetal alcohol syndrome. Again, this is false because it was 1 to 5% of first grade students. And number five, children with fetal alcohol syndrome never need strategies to be successful in the classroom. And again, that's false. These children definitely need strategies in the classrooms to be successful. And here are my list of references. Thank you.